Hey guys and shine, Dr. Allen here, and today I'm going to show you how to wear contact lenses. I'm going to show you how to put in contact lenses, how to remove contact lenses, and even how to clean and take care of your lenses. Plus, we'll share some bonus tips and answer some frequently asked questions throughout the video. If you're new here to the channel, my name is Dr. Joseph Allen. I'm a board-certified doctor of optometry, and here I help people learn all about the eyes, vision, and finding the best vision product. So if you like learning about the eyes and seeing your best, then consider subscribing. Now, before we get too far into it, I just want to say it is best to first have a contact lens and removal insertion training course at your local eye clinic or optical store. That way you get in-person training in case you need to troubleshoot some difficulties you're having with, or you happen to have poked your eye in the process. Then you have a professional right then and there to help you out. But of course, if you need some extra help, that's why we're here, and feel free to rewatch this video as needed. Now, step number one, we need to wash our hands really well. Also cleaning our eyelids and eyelashes, because we're going to be touching our eyelids here, and we don't want to introduce anything, and we want to reduce our chance of infection. To clean the eyelids, I personally like using eyelid wipes here, and I'll list some of my favorites in the description, but of course, always ask your local eye doctor what they think is best for you. Also, a bonus tip here is that when you dry your hands, use a lint-free towel, something that's not going to leave lint on the surface of your fingers, which can get on the contact lens and get in the eye. Just a good thing to think about. Now, step number two is we need to check and verify our contact lenses. This is important because we don't want to switch up our prescription for our right eye with our left eye and vice versa. Since I am right-handed, I usually always start with my right eye, and I like to separate my right contact lens on the right side of where I'm working and the left one on the left side. Just makes it a little easier. Now, step number three is we need to prep the contact lens for insertion. We first need to open the blister packs, and usually contact lenses come now in these little blister packs here. We just pull back the foil, and then using the padding of your finger, simply touch the contact lens, and it should pull up pretty easily. Then use your opposite hand to flip the lens back around and rest it on your pointer finger. Try not to touch the lens with your fingernails in this process because you could potentially damage the lens. If you are somebody with long fingernails, then I will share some bonus tips toward the end of the video. Step number four now is to inspect the lens for any defects or if perhaps there's lint or something on the lens. It's possible for some contact lenses to tear or get little chips in the side. So you want to make sure you don't put a damaged lens in the eye because it could scratch and hurt the eye. If the lens happens to look dirty for some reason, then make sure to rinse the lens with a multi-purpose contact lens solution. Now, the next step is really important. We need to make sure that this lens is not inside out. To do this, I like to just look at the lens from the side and make sure that the edges come upward like this image here. If you look at it and it seems like the edges kind of flange going outward, then that is likely inside out. Another way to test for this is something called the taco test, and this is where you take the lens and fold it in on itself. If the edges fold in sort of like a taco, then that would be the correct way and the lens is set in the right way to put in. But if the edges flange kind of outward and have kind of a kissing shape, then that means it's inside out. Let me know in the comments which way works best for you. Okay, now I'm going to show you how to apply this lens onto the eye. First, a lot of beginners do find success using some sort of a mirror, whether it be standing upright like this, or some people find it easier to set it down on the counter. That way they're able to look down while they're putting in the lens. And just due to gravity, the lens stays on the finger a bit easier and they have more success with it. Give each a try, see what works well for you. Now, a huge secret to success of getting these lenses in easily is to hold the eyelids. To do this, I use the hand that's not holding the contact lens. I reach over, you hold that top eyelid right along the margin of the eyelashes, and you hold that tightly. That'll prevent you from blinking and preventing that lens from getting in the eye. I then use the middle finger of the hand that has the lens, and you hold that eyelid down, and then you just bring the contact lens right to the surface, and then blink. And it came out, and now it's on. Now I know I made that look easy, but I've been doing this for close to 20 some years. A lot of people do find it a little unnerving just because this contact lens and something is coming close to the eye, and it's just our natural reaction to want to blink it out. What's great though is the contact lens acts kind of like a shield, and it protects the eye, and it should never hurt or feel irritated. But if this is your first time, do not feel discouraged if you accidentally blink it out. This happens to a lot of people. If you do drop the lens or blink it out, then just rinse it quickly with some multi-purpose solution and then try again. I'll now demonstrate it again, but this time doing it on my other eye. I am very much right-handed, so I usually just stick doing the same procedure with my left and right hand. However, it is best etiquette to switch and do it the opposite way. So again, I took out the contact lens and I verified it doesn't have any chips and it's set the correct way. So now I'm going to hold the upper eyelid with my hand over here without the lens. I'm going to hold down the lower eyelid with the hand that has the lens in it. And just touch it to the eye, and it's on. I will mention that when you first wear the contact lenses, do not be surprised if your vision is not perfectly 20/20 or super clear right away. Sometimes it takes a few blinks and even up to a minute or two for the lens to settle in the right place, and that will give you better vision. So make sure to just give it a moment to focus in. And just know that most people do not get this right away on their first try, and if you need to do it multiple times and your eyes get a little red and irritated, that's okay. Just take a break, use some re-wetting drops, and then of course, talk to your local clinic if you need some additional help. But otherwise, congrats, you got your lenses in. Okay, now for some bonus tips and some frequently asked questions. The first question is, what do you do if the lens just won't come off your finger and stick to the eye? Some contact lenses just seem to have a hard time coming off and attaching to the corneal surface. So to help with this, first I like to have people's fingers bone dry. Make sure that the hand is very much dry and not even just a little bit damp, because I find that the lenses just come off a little easier. Another thing is you can try to make sure that that lens is just barely resting on the surface of that finger. That way it's less likely to attach to the finger with water tension. Otherwise, be sure to ask your local clinic what they think could help you, or perhaps just switching to a different contact lens that has a better modulus, which is kind of the stiff integrity or shape holding of the lens, and that may make it easier. Question number 2 is, what do you do if you just can't stop blinking and the lens just won't go in? Well, first, I would say make sure you are holding the eyelids very firmly and doing that proper step. But second, and I learned this in fact from somebody who commented on a previous video I did on the subject, is to get closer to the mirror. For some reason, getting closer to the mirror seems to maybe change your perception and allows people to not kind of freak out and try to, bat out the lens coming closer to the eye. This is just a tip that some people have found helpful. Question 3 is, what do you do if you drop the lens, such as on the counter or even on something like the bathroom floor? In this case, you definitely want to rinse and clean that lens. Using a multi-purpose contact lens solution, you can just rinse the lens really well, maybe clean it with the palm of your hand and your finger, and then, again, once it's ready, reinsert. I'll admit that sometimes finding a lost contact lens on the floor or somewhere you might have dropped it can be a challenge. But that's exactly why some contact lenses are made with a small visible tint so that you can find it a little bit easier. But yes, always make sure you clean those lenses. And then the final question is, what about long fingernails? This can be a challenge. So first, of course, cutting the fingernails is an option. I had one patient who purposefully left one fingernail shorter while they wore long fingernails on the others, just so that they could safely put in their contacts. But there are also some kind of alternatives to putting in the lenses. Now, this can be a little bit more challenging, but a method that can work is placing the lens further down and a little on the side of the finger that you're going to be putting the lens in with. You still hold the eyelids in a similar way, but then you touch the lens to the eye, but you have to come at it from a little bit of an angle and from the side, rather than using the finger pad directly. But as always, if you're having challenges, talk to your eye clinic what they think is best for you and how they can help. So there you have it. That's how to put contact lenses in, and now we of course have to learn how to take them out. So let's get into that. Step number one is we need to wash our hands and clean our eyelids and eyelashes really well. We're going to be touching around our eyes and we don't want to potentially get an infection, and cleaning the eyelids will remove any extra dead skin cells, skin oils, or sweat from around the eyes. Now, a huge pro tip for success here is to dry your hands really well. Make sure they are bone dry. This is going to make it a lot easier to remove that contact lens. No joke, bone dry. It will make a difference. Now, step number two is you want to put your fingers together sort of like this so that they can make this nice, easy kissing motion. That is the exact same type of motion you're going to make to pinch and remove the contact lens. Now, using your other hand, you're going to hold the top eyelid. You're going to use the middle finger of your dominant hand to hold the lower eyelid, create that kissing motion, touch the bottom of the lens, pinch, and there you go. Now, there is another technique. As you saw, I just went straight on while keeping my eyes straight and just touched that lower 1/3. But there is another technique, now that my fingers are bone dry, and that's to look up, still with the same technique of using the kind of finger kissing. I look up, but I drag the lens down and then remove it. The importance is that when you're looking up, you are just dragging the lens down so that you can grab onto that lower 1/3 of the lens. I prefer to pull the lens downward and remove rather than sliding it to the side, because if you slide it to the side, there's a chance that you still may grab and, brush against the surface of your eye, causing an abrasion, where if you pull down, you're less likely to do that. But now, if you've removed your lenses, if they are a single-use contact lens or a daily lens, then those you're done with. You can throw those away and they're simple and convenient. But if you are using a 1-week replacement, a 2-week or a bi-weekly replacement contact lens, or a 1-month contact lens, then you are going to want to clean that lens appropriately, disinfect it, and then store it overnight so that the next day you can wear them. And believe it or not, most people usually don't clean them appropriately. And there's some extra cool tips in that process that can make them more comfortable over their wear use, which is exactly what we're going to be covering in our next video. So don't miss that video. We'll put a fast link to that in the description, which we'll be covering in just a moment. So the number one question is, if you are wearing a contact lens, can it get stuck under the eyelid and potentially get behind the eye? Thankfully, no. It's impossible for a contact lens to slide up behind the eye because there's a protective tissue there that prevents it. However, it is possible for sometimes contact lenses to fold on themselves or slide up and get stuck underneath the upper eyelid, which, if you've ever felt that, it's not super comfortable. Usually you're very much aware that something is there. There are some rare cases where people have found 10 up to sometimes even 20 some contact lenses for some people, but those are like rare phenomenons. Most people can feel and tell that there's a lens up there. But in case you ever have a lens that gets stuck underneath the eyelid, here are some quick tips to help you out. Tip number one is don't freak out. Just remain calm. It's going to be okay. The second tip is to look down and blink frequently, like an excessive amount of times you're going to want to be blinking. This process, plus with the feeling of irritation, your body's going to produce a few more tears, and the blinking action will drag that lens, and hopefully it'll just fall out on its own. But you may need to sit there and blink over and over and over again for a few minutes. The next step, if it's still not coming out, is to use your finger looking down, push on the eyelid, and encourage the lens from where you can feel it to kind of push toward the open part of the eye. Again, try to blink frequently when you can, but you may need some time to just kind of encourage it and push it more toward the center. Occasionally, you do have to kind of look up. Sometimes the lens will grab back onto the cornea just to get back to its normal position, but otherwise, you just need to keep blinking and encouraging it, and eventually the lens often does just fall out. Sometimes eye wash can also be used to rinse the inside of the eye and try to flush out that lens, but if things just are really stuck up there and you can't get it out, do not be afraid. Call your local eye doctor. We can remove that for you. Question number two is, what do you do if you absolutely can't get the lens out, or you're worried a piece of it tore, or there are pieces of lenses stuck somewhere under the eyelid? In that case, then, of course, call your local eye doctor. We, in fact, have some dyes and medications. Not only can we numb the eye, make it more comfortable for a time, but the dyes will get into the contact lens and show us where the pieces may be hiding. And if you happen to scratch your eye at any point during insertion, removal process, then we can evaluate to make sure there's not an abrasion and, of course, treat it appropriately. But now that we've covered how to put in contact lenses and remove them, now let's cover how to clean them and take proper care of them. Cleaning your contact lenses properly will not only dramatically reduce your chance of getting an eye infection, but it also can improve the comfort of wearing your contact lenses. Now for this video, I'm going to showcase two different styles or types of contact lens cleaning solutions. This first one is just a multi-purpose contact lens cleaning solution. This other is a hydrogen peroxide based one. Now the different brands and manufacturers, I found success with both, but I will say sometimes it depends on not only the person who's wearing and using them, but also the type of contact lens that they're being fit in. So be sure to talk with your local eye doctor what they think would be best for you and your lens. But depending on what solution you use, just know that the instructions can vary. So it's really important to read the instructions on the back of the box and bottle. For example, if you don't read the important red highlighted information on the back of this box and use it incorrectly, you could end up causing a mild burn to the eye. So again, be careful and read the instructions. So let's start with the multi-purpose solution here. Now the first step of the multi-purpose solution most people miss, and it's one of the most crucial, especially for making the contact lenses more comfortable over their life. That first step is in fact to rub the lenses on each side with a little bit of solution. This brand of solution says to use 3 drops of multi-purpose solution on each side of the lens, and then you're going to rub the lens for about 20 seconds on each side. This is done just with your finger and the palm of your hand, and doing so will not only break up microorganisms from the surface, reducing chance of infection, but then also break up different proteins that often stick to the lens, kind of like barnacles on the side of a ship. And those proteins, if you don't break them off, can build up and cause irritation and even allergic reactions for some people. So yes, cleaning the lens and rubbing the lens like this does make a huge difference for things like comfort. The only tip I'll give is don't rub the lens too hard because it is possible to rip or tear the lens if you're a bit too aggressive. Next, you are supposed to rinse the lens for about 5 to 10 seconds on each side using the multi-purpose cleaning solution. Then you place the clean contact lens into the contact lens case, and then of course fill the case with solution. I will mention it's super important to always use new multi-purpose solution when filling the case. Never top it off and reuse old solution. Otherwise, you might just be asking for a nasty contact lens infection. Once the lens is submerged, then you just place the contact lens cap back on, secure it tightly, and then let it sit, usually overnight, for at least 4 to 6 hours, depending again what's instructed on the back side of the bottle. Now, another pro tip that a lot of people miss is you're in fact recommended to clean these multi-purpose contact lens cases at least once a week, which you simply just put some multi-purpose solution in the case, rub it with your clean finger, and then you can again leave it out to air dry. It is also recommended to replace the case itself every 3 months. However, I will share that a lot of times contact lens solutions, when you buy them, come with a free case. And usually you run through a solution at least once a month. So I personally like to replace the new case every single month. But again, talk to your eye doctor what they recommend for you. Now the next day you wear contact lenses, after you put the lenses in, again, make sure that you throw out any of that used solution. But then leave the case and the caps out to dry. Leave them opened facing up so that they can air dry. Otherwise, a little bit of solution can be left behind and that can get carried forward to the next day, which you do not want. And a very important extra tip here is to never use tap water, bottled water, or any other source of just plain water as a replacement for your multi-purpose disinfectant solution for your contacts. Water and contact lenses do not mix. It just dramatically increases your risk for some of the nastiest eye infections, which can lead to permanent vision loss, scarring, and some people, unfortunately, need corneal transplants for some of it. So again, do not use water. Now let's switch over to talking about hydrogen peroxide solutions. Now there's a few benefits to these types of solutions that doctors may recommend them. First of which is that there's no preservatives. So if somebody has very sensitive eyes, doctors may recommend this one. There's also no rubbing required for the lenses, and there's some research to suggest it may be a little bit better at killing some types of germs and bacteria. But there's a few other unique things about it you need to know. First of which, again, there is a huge warning in red on the side of this box. There's also a red tip on the bottle, and that's because hydrogen peroxide solution, if gets directly into the eye and isn't neutralized, it can cause irritation and like a burning sensation, which nobody wants. So again, it's important to read the instructions. Now, assuming you've already washed and dried your hands and removed your contact lenses, using a hydrogen peroxide solution, it has a cool, different, unique contact lens case that has these small little baskets. One of them has a little R written on it for the right lens, so you can keep track. You'll put the right lens in, you'll then open the left side, put the lens in this basket, and then have them both closed. You'll then rinse both lenses for about 5 seconds with the hydrogen peroxide solution. Again, no rubbing of the lenses required. You'll then fill the clear part of the lens case up to the fill line, which is about 3/4 of the way up. But you'll want to make sure that you don't underfill or overfill it. Then you simply put the lens holder into the case and secure tightly, but do not shake this. If you look closely, the metal element at the bottom will start to fizz and bubble, letting you know that it's working. And then you just let it sit for at least 6 hours. And that's the important thing to know, is that if you have to put in your contact lenses sooner than 6 hours using this type of cleaning method, it's probably not going to be the best choice for you. Because if it put it in under 6 hours, the hydrogen peroxide solution has not been fully neutralized, and it's going to burn putting those lenses in. Again, if you're using a hydrogen peroxide solution, you need to have it sit for at least 6 hours. The other pro tip is to make sure you always replace this case every single month, because the metal element at the bottom can wear off over time. Thankfully, new boxes of solution always have a new case in it as well, so it's easy to replace every month. But with either way, whether you're using the multi-purpose solution or the hydrogen peroxide solution, if the eyes ever burn, feel painful, appear red, irritated, then take out your contact lenses and give your eye doctor a call. Without a doubt, every single year we do get a small handful of people who accidentally get the red cap bottle in the eye. I don't recommend it, but thankfully we're able to help people, so if that ever happens, even by accident, again, just give your eye doctor a call. Hey, if you liked today's video and you found some value in it, please do us a favor. Hit the like button on your way down to the comments section and consider subscribing to the channel so that you don't miss any of our future videos, including some upcoming videos we'll do breaking down some of my favorite contact lenses and favorite eye drops to use with contact lenses. But for now, thank you so much for watching. Keep an eye on it, and we'll see you in that next video.